Hi, hello. My name is Lauren, and I'm going to be reviewing the grants with Mercy Care. So we wanted to share and provide some general education over some of the grants that Mercy Care oversees in the network to better inform individuals and the public about resources that may be available to them. First, we're going to go over block grants. There are various types of federal grants available, but to start, we will share about some of the larger grants that are classified as block grants. Block grants are defined as a non-competitive formula grant that are mandated by the U.S. Congress to fund services to treat substance use and mental health needs. We have two different types of block grant funds that are federally regulated based on eligibility and diagnosis. The Substance Abuse Block Grant, sometimes referred to as SABG, is a federal block grant for individuals of all ages with substance use disorder who are uninsured or underinsured. There are several priority populations that are targeted, and we will review those in our next slide. Some of the overarching goals of the SABG grant include access to a comprehensive system of care, ensuring access for underserved populations, providing gender-specific treatment options, promoting recovery and reducing risk of communicable diseases, as well as creating accountability for outcomes and access to quality services. The other block grant that Mercy Care oversees is the Mental Health Block Grant, sometimes referred to as MHBG. This block grant has three different target populations, including adult with serious mental illness, children with serious emotional disturbances, and people experiencing their first episode of psychosis. This grant is also designed to serve individuals who are uninsured or underinsured. The Mental Health Block Grant also has several goals, including access to a comprehensive system of care, including employment, housing, and other mental health services and supports, promoting participation by consumers and their families in the planning and implementing of services, ensuring access for underserved populations such as rural, older adults, and people experiencing homelessness, promoting recovery and creating accountability for outcomes and access to care. For the purpose of this presentation, underinsured is defined as individuals who require medically necessary services that are not covered by their traditional access coverage. The Substance Abuse Block Grant identifies several targeted populations by priority. The targeted populations in order of priority include pregnant women and teenagers who use drugs by injection, pregnant women, teenagers who use substances, other persons who use drugs by injection, substance-using women and teenagers with dependent children and their families, and all other individuals with a substance use disorder, regardless of gender or route of use. Pregnant women and people who inject drugs are the most targeted populations because it is more of a public health approach that addresses risk factors. Both populations have a risk of transmission of communicable diseases, and pregnant women's substance use would affect both the pregnant woman and her fetus. So there is a requirement that these populations need some attention and priority for receiving treatment. The goals of targeting these populations are to limit wait times and provide interim services or in-between services if they can't be admitted into a treatment program within the time frame required. Interim services usually include education on health risks and services available, along with referral to physical health services. Here are the list of our current SABG providers in Maricopa County. The star next to some of the providers include residential substance use providers. There's also a direct link to the Mercy Care website that will have contact information and the most up-to-date list of SABG providers and programming. The MHBG grant is available to help provide mental health treatment services to individuals who are uninsured or underinsured. There are three populations that are served under this grant, And the populations again are adults with serious mental illness, children with serious emotional disturbances, and individuals experiencing their first episode of psychosis. All eligible individuals are also uninsured or underinsured. For MHBG, the serious mental illness populations, they include adults with a diagnosable behavioral, mental, or emotional condition that impacts major life activities such as basic daily living and impact social relationships and employment. These individuals also have a serious mental illness designation and are assigned care with a behavioral health clinic. The clinic will provide services under this funding. Some services that are provided include counseling, case management, skills training, employment, and housing services. For MHBG, serious emotional disturbed, and we can call that SED for short, the eligible populations include individuals birth through 17 years of age who have a diagnosable behavioral, mental, or emotional condition that interferes with family, school, or community activities. There are many services that are available to this population, including but not limited to counseling and case management. For the MHBG First Episode Psychosis, or FEP for short, it's a program on the early identification and support services to individuals who have experienced a first episode of psychosis within the past 2 years. Individuals do not have to be designated as SMI or SED to be eligible for services. Some of the services include, but are not limited to, recovery coaching, peer support, school and employment support, counseling, medication treatment, and family education. Here are the list of current MHBG adult and FEP providers in Maricopa County. There's also a link directly to the Mercy Care website for more information. Here is the list of current MHBG SED providers in Maricopa County that may use the funding to help children who need behavioral health services. Now we will talk about different funding and/or grants that Mercy Care oversees. Cost reimbursement funding usually doesn't cover direct services, but it can be used to improve or expand programs. On this slide, we have a table of the different types of cost reimbursement funding that Mercy Care oversees. I will provide some details about each of the funding, but also encourage individuals to use the link in each of the sections to learn more. The overarching goal of the Arizona State Opioid Response Project, or SOAR, is to increase access to medication-assisted treatment, or otherwise known as MET, coordinated and integrated care, opioid use disorder and stimulant use disorder recovery support services, and prevention activities to reduce the prevalence of opioid use disorder and stimulant use disorder and opioid-related overdose deaths. The Ecovid response grant is to help address needs of individuals with serious mental illness or individuals with substance use, as well as individuals with a mental health disorder less than a severe mental illness. Services may include, but are not limited to, medication-assisted treatment, counseling, and peer support. This grant is also intended to help healthcare professionals. The Children's Behavioral Health Service Fund, otherwise known as CBHSF, was created from Senate Bill 1523 and is also known as Jake's Law. And funding is intended to provide behavioral health services for children who are uninsured or underinsured that are referred through an educational institution. The website link will also provide more information and a link to the Access website for additional information. The Governor's Office Substance Use Disorder Services, otherwise known as GoSUDS, is a funding source administered through the state in order to increase member access to substance use-related treatment and navigate our existing network. GoSUDS is what is known as a payer of last resort, meaning if the member doesn't qualify for any other grant or funding types, they may become eligible for coverage through this funding. The City of Phoenix American Rescue Plan Act, otherwise known as ARPA, was allocated to help individuals who are uninsured or underinsured and a resident of Phoenix. They do not have to be a Mercy Care member to access services such as mental health services, counseling, substance use treatment, suicide prevention, and eviction prevention assistance. Please note at the bottom, there is a link that can take you to the webpage that provides more information along with the providers to access those resources. And here's our contact information should you have any future or further questions regarding grants that Mercy Care oversees. Thank you.